Hello, everyone. Welcome back to the Mass Retirees Weekly Update. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, this week, I have a very special guest joining us, Brendan Stoddart. He is from Senscio Systems. Senscio Systems, of course, is the company that is behind the Ibis telehealth platform. Ibis is something that Mass Retirees has been promoting and working with now for the past several years. Senscio has become a very important partner of ours. They are a Massachusetts-based company. They have come up with a very innovative and useful technology that will help retirees in the privacy of their own home and very conveniently manage their own chronic health conditions, and with the goal of keeping people healthier out of the hospital, which leads to a better quality of life for all of our members, as well as hopefully over time, keeping healthcare costs as low as possible. We know that by lowering healthcare costs, it lowers health insurance premiums and saves everybody money over the long haul. So this is one of those rare instances of a true win-win. Now, if you've been paying attention to our weekly messages, and if you've read the most recent Mass Retirees newsletter, The Voice, for our March edition, you know that we just announced the partnership between Senscio Systems and UniCare, which of course is the primary health insurance company that most of our retirees are insured through under the Group Insurance Commission. UniCare and Senscio have partnered up to provide access to the Ibis telehealth platform to UniCare subscribers. And this is, again, a true win-win. We're very excited about this partnership. We think that some very positive outcomes are going to come for our members who will be eligible for this. In addition to working with UniCare, Senscio and Ibis are also working with the Massachusetts Interlocal Insurance Association, known as MIA. MIA is a division of the Mass Municipal Association. They provide group health insurance benefits to 140, 150 communities across Massachusetts and school districts and so forth. The insurance benefits that they provide through MIA, it's all Blue Cross Blue Shield. They provide an excellent service. So between UniCare and MIA, along with Blue Cross, the Ibis telehealth platform is now going to be available to a very large number of public retirees, and we're very, very excited about this. So we have invited Brendan to meet with us today to talk a little bit about how the platform works, and most importantly, show you how it works. So I know for myself, it's one thing to hear about something and talk about something or read about it in the newsletter, and it's very different to actually see it in action. And when we sat down a little bit over a year ago with Brendan and Piali Day, the founder and CEO of Senscio Systems, at their headquarters, and they walked us through a demonstration of exactly how Ibis works, and we're able to hold the tablet in our hands. And by the way, the tablet is very, very similar to an Apple iPad or some of the other tablet devices that you may be familiar with. And they have come up with a very easy to use, user-friendly, if you will, interface that is super simple for people to figure out. It's not going to overwhelm you, even if you're someone who is not overly technologically advanced. You shouldn't have any problem utilizing the Ibis platform. And the most important part of it is you can utilize it in your own home. That's really the goal of this, to help you manage your health, keep you healthier, and do so in your own home, which is absolutely ideal. So with that, let me turn it over to Brent and talk a little bit about how this operates, the core audience that we're focused on, the fact that you have to be a Medicare enrollee in order at this time to be eligible for this. As of today, Medicare is paying for Ibis telehealth and related services. So as of now, there is no additional cost to retirees to utilize the system. We're hoping that that's going to continue for the foreseeable future anyway, if not forever. But as of now, there is no additional cost out of your pocket to utilize this system. So Brenton, let me turn it over to you. Talk a little bit about how this works, and then let's see it in operation.
Alrighty, Sean. Well, first of all, thank you so much for having me and for the support of the Mass Retirees over the last couple of years of our partnership. It's been a true pleasure to work with you and Bill and Nancy and everyone over there at the retiree organization. And we hope this serves as a useful next step to continue to spread the good word of what Ibis and Senscio are all about. So to that point, Senscio was founded almost 10 years ago as a data company who was looking for ways in which we could improve industries to help individuals leverage, the power of technology. And it became very apparent to us early on that healthcare was a perfect place to get started, specifically for individuals who have chronic conditions, things like diabetes, COPD, heart failure, hypertension. There's so much that goes into managing those conditions on a daily basis, right? Taking medication, recording vital data, making sure that we attend to our various appointments and our therapies and our exercises. And it actually was born out of a personal story to our co-founders, who are husband and wife, who had a father who struggled with congestive heart failure. And he wound up in a bit of an entrapment cycle hospital where he would get admitted, with a new treatment, a new diagnosis, maybe a new medication, and sent home for a period of time for him and his wife to manage to the best of their ability his fluctuating health statuses. And that management at home became very, very complicated and very, very difficult to keep up with. And he wound up back in the hospital, then wound up back home, then wound up back in the hospital. And eventually, maybe this story is very familiar to the audience that I'm speaking to, removes the ability to be independent, to be confident, to be comfortable, and to live a real dignified life amongst those various health challenges. And we sought out a solution in an attempt to make that easier and to help people stay out of the hospital and stay out of the emergency room unless totally necessary, and to provide a connection between how their chronic diseases were changing in the home to the medical professionals that support them in the doctor's office, the visiting nurses, the whole team and care team of support that you typically have when you are in this kind of health situation. So to be abundantly clear, our members who participate in Ibis are required to have 2 or more chronic disease diagnoses. That applies to the aforementioned more popular chronic diseases, but things in addition, osteosclerosis, chronic pain, things that you might not even imagine as a chronic condition would qualify you for our services. And in our partnerships with UniCare and Maya, they've helped us to identify, hey, who are the perfect people that would benefit from something like Ibis? And I encourage you, if throughout this presentation you think that that might apply to yourself or a loved one or a friend or anyone in your community, to connect and receive a demonstration personalized to you and your health needs. I will certainly capture kind of how the program operates, but it's easier to understand the value when I'm able to speak directly to your needs in the home, given your specific health situation, because all of our health journeys are incredibly personal. And we want to make sure that the treatment that you receive and the care that you receive matches that level of sensitivity and intimacy. Now, presently, Ibis Health is operating in 3 states in New England. That's Massachusetts, Maine, and New Hampshire. So unfortunately, for those of you who do not live in those 3 states presently, we are not an available service to you. Although in 2023, it is a big goal of Senscio and Ibis Health to increase our states of coverage, specifically states like Florida, New York, Virginia, South Carolina, where we know we have a lot of retiree access through UniCare Maya and the mass retirees. So while not today, hopefully another day, and keep us in mind. And we'll certainly be sharing that news throughout the year through the voice and the various communication mechanisms we have available to us. So given that description of what Ibis is and what Senscio was founded on, our brand promise to all of our members is that we will provide you the right care at the right time, in the right setting, and by the right person. Now, if you imagine kind of a utopic healthcare environment, it would be everyone operating off of a simple understanding of what's going on. And too frequently do we allow ourselves to misunderstand or not engage early enough to take small issues in the moment that they're detected and treat them right then and there to prevent them from becoming larger issues. And those larger issues you can equate to sick visits to the doctor's office, trips to the emergency room, and in the most severe cases, long-term hospitalizations. So our goal is to create a conduit and really a data communication mechanism between how your health is changing in the home and a complete virtual care team who's here at the ready to help you in situations where your health might be starting to decline. And this data conduit and communication mechanism that I'm describing is the Ibis tablet, which I will pull up in just a moment. Sean, any questions or commentary on what I just covered in terms of the origin of the business?
No, I think, Brenta, that was excellent. I think it provides our members with a clear understanding. One of the points I just want to reiterate is that if you are utilizing, Ibis Health, your privacy is protected the same way as when you access any other healthcare service or anytime you deal with Blue Cross or with UniCare. That is an extremely important part of what Senscio has done in putting this platform together. They have very meticulously, approached data security and member privacy throughout, this last several years as they were building up to this point, where it's been ready to sort of roll out to the masses. And that's one of the reasons why we are so comfortable of partnering with Senscio and with UniCare and with Maya and Blue Cross to provide this product, because we're confident in the security and the effectiveness of it. I just wanted to take a moment to reiterate that with our members and hopefully provide a little bit of sense of comfort, in a time when you hear about data breaches and nothing is ever 100% secure. So I want to be careful of what we're promising here. But we're very confident that this is no different than if you go into your doctor's office and you're having medical services provided. It's that same level of security, if not even better than that. So
thank you, Sean. No, I really appreciate you mentioning that. And I'll draw back to something I said in the origins of Senscio. We were a data company first that got into healthcare instead of vice versa. And so data security and the way we structure that data is one of our specialties. So I'd be happy to explain in any more detail to those who are interested. But of course, as a healthcare company, we are totally HIPAA compliant, like any medical practice or healthcare service that you receive. So I'm just going to pull up an actual screen share of the user interface on the Ibis tablet that each of our members receive. Like Sean mentioned in the introduction, it's about the same size as an iPad or an Android tablet, something that you've probably experienced or used in the past. This tablet is something that Ibis Health will provide you for your participation in the program, so you don't need to worry about having a tablet already at your disposal. And our tablets are dedicated to Ibis because as a healthcare organization that wants to make sure we are connected as frequently as possible, we wanted to actually provide you a dedicated device that could be somewhat of a health care command center in your home. And I'll show you what that looks like in just a moment. Do not worry if you do not have internet. We are able to provide a little SIM card in the tablet itself that operates off of 4G cell towers. So if you do not have your own personal Wi-Fi, that is something that Senscio and Ibis will provide for you. Now, when I pull up the user interface, there'll probably be a lot of icons out there that grab your attention. I hope you appreciate the interface is heavily pictorially driven. The text that you see is at a low comprehension level. We wanted to make Ibis available to anyone that felt like they needed it. So without further ado, I will share my screen on the Ibis tablet and show you the user experience. Alrighty, Sean, can you see this okay?
I can. It looks good.
All right, perfect. So what you see in front of you is exactly what you would see if you are an Ibis member, but keep in mind, this entire program, if you are to join, will be completely customized to your health needs. So what I might demonstrate today isn't necessarily applicable to you as an individual, but I just want to capture the breadth of what the system has to offer. And by the time you received one in your hands, it would have all of your medication loaded in. It will have your specific vital monitoring tasks loaded in and all the appointments and therapies and health goals that you are trying to accomplish. I want to reinforce that this program is all dictated by you. the user, right? It is at your discretion on any day to report to us exactly what you want. We might make recommendations for what we think is the best care plan for you to follow. And that care plan is really created in collaboration with your primary care physician, factors in all of their goals and their inputs and what they would like to see you do in the home setting. But at the end, you're clicking the buttons on your tablet in your home. And on any day, you might click something you want to tell us. You might ignore something you don't want to tell us. Of course, we advocate for total transparency, but this is your experience and this is your healthcare data and this is your information. So what you see at the bottom of your screen is a series of icons that form the care plan for my demo account, Mike. Some of those to look familiar to you, like a little pill bottle for medications, or a cartoony man with some weights in his hands, or an oxygen saturation meter there on the far right, the device that measures our pulse and our oxygen level. And I'll just click through a few. It's all touchscreen, very simple to use. We provide these reminders and kind of guidance on a daily basis, and our members will, in return, interact with the icons that they see. They will report different elements of their health status. For specifically the vital monitoring components of the program, like blood pressure or oxygen saturation or weight, we will provide you the vital monitoring devices to be able to do that. We can provide them as Bluetooth enabled so that the information could directly be communicated to the tablet, or we can provide them not connected that manner. So you can take the vital, look at it, think about it, reflect on what you did yesterday or earlier today that might have led you to that vital. And a primary component of the Ibis experience is education about yourself, your diseases, its empowerment in your ability to manage the moments in which you start to get concerned that something might be going wrong. So I'm going to open a good morning icon. We always like to start our day off with a positive quote to get us on the right foot. Who doesn't love Dr. Seuss? The more that you read, the more things you will know. The more that you learn, the more places you'll go. And in a manner of interacting with this icon, I will just select Good Morning Ibis to let us know that we've gotten started with our day. And you'll be able to see reflected on the bottom of that care plan that the Good Morning icon is now indicating as done. And this is very valuable to you as the user because it also helps you keep track of, hey, what have I done today? Did I take my morning medication when a few hours later we might have forgotten whether we did or not? Or, hey, did I do my exercises? How well am I on track for my health goals as it relates to my chronic diseases? Now, good morning is just something simple that we think everyone should start their day off with. But of course, after we wake up, one of the first things that many of our members have to do is take some medication. So I'm going to open the icon indicated with the 7:10 a.m. time slot right after good morning. Now, one of the very impressive values and features of the Ibis tablet is that we actually go through the hard work to coordinate with your pharmacy to collect the NDC code, which is a specific number associated with the manufacturer of the medication that you take, such that we are able to display an actual image of the pill that you take in the home. And Sean, our medication adherence, when we added this feature, it went up incredibly because I don't know what a lansoprazole is, but I know what my tiny pink and black capsule is, right? And that's just a way that we try to simplify kind of the complexity of healthcare naturally and make sure that you know exactly what the best course of action that you can take on any given day is. And we are your cheerleaders to make sure that you are able to do that. And we're your barrier breakers whenever you run into obstacles to be able to do that. You have a side effect associated with a medication, or you're just feeling a little down and don't have the motivation or the energy, or you want to do something dramatic to shake up, your living situation and what you want to do. We are here to help you get to the point where you feel comfortable, where you feel confident, and where you feel safe in your home, living with these chronic diseases via the connection that a device like our tablet can offer. So I won't go through every icon here at the bottom because I could go on for minutes, but I hope you get a sense of how you engage and interact with a device like Ibis. And I want to reinforce that all of this health information here is being received by a virtual care team that Ibis Health Services staffs. And this care team comprises of, member advocates, nurses, clinicians, nurse practitioners, MDs, pharmacists, mental health clinicians, pretty much everything that you might want in your healthcare experience, whether that's some therapy services or pharmacology review of medication plans, or just a consultation on a bruise or a rash that might have emerged over the next day. We are here for you to address those issues. We will coordinate all of your IBIS health data with your providers. That can be your primary care physician, can be your specialist, of course, only those to whom you consent us to share information with. But a primary component of our brand promise to you is that, hey, if we are all going to support you in the home, we just need to know one simple thing, and that's how you're doing. And this is the way for you to let everyone know how you're doing. The goods, the bads, the tough days, everything in between. And hopefully that experience to you allows you to follow your care plan more adherently, to more quickly accomplish your health goals, to feel calm and stable in the environment that everyone wants to be. And that's our home.
Well, I think, Brenton, if I could just expand on something you just touched on, and that is that one of the goals of this platform, and one of the things that makes it so appealing, is that it really helps to simplify your access to healthcare. Even in the best of times, healthcare can be confusing. The various names of medication are confusing, and that's where having that image of what the actual pill looks like, to me, is something that's useful. And if you're dealing with an illness or a chronic condition, that could be taxing enough, and then you add in the complications and the confusion that comes with treating that illness or that condition, and it can be pretty overwhelming. And that's one of the benefits of Ibis, is that it helps to reduce that type of stress, give you a little bit of reassurance, have someone on a daily basis kind of looking out for how things are going. None of this replaces your relationship with your doctors. There is no way to replace that. This simply is an additional supplement that will help yourself and your medical team to manage your care, and to also have that extra set of eyes and ears on just looking out for you. Brenton, if you can, I assume it's going to be a component of this, but if someone were to miss taking their medication, or tested their vitals and there was some type of a red flag, if you could talk a little bit about what that leads to, and the outreach and the follow-up that will take place.
Perfect. Thank you, Sean. So as I discussed, that virtual care team who is standing by underneath this tablet, and this is ultimately kind of what makes Senscio and Ibis special and unique, is an artificial intelligence engine that is sorting through all the data and generating the moments in which your health status starts to deviate based on the data that you've registered into your tablet. So Sean mentioned a very common instance is you wake up. Let's role play here an example of an IBIS member who had COPD, lung disease, and they use a device to help with their breathing, whether that's CPAP or some oxygen. And they wake up one morning, and in their IBIS plan, as shown here on Mike, they have a little reminder to register their oxygen saturation. Now, if Mike, my demo account, were to come in, click open his oxygen saturation icon and report an oxygen, that's a typical value for him. And that's all customized and unique to the individual, right? Because what's usual for me might be different than what's usual for you. But let's say for Mike, he comes in and registered an oxygen of 98% and a pulse of 65. Beautiful, beautiful vitals. But one morning, for whatever reason, Mike, his oxygen saturation is quite lower than normal. Mike will engage this reminder and go ahead and input the value that he reads. I'm going to be a little dramatic for the purposes of demonstration, but let's say Mike found his oxygen saturation to be 89%, and his pulse was closer to 70. His heart rate has accelerated. Go ahead and hit accept into the device here on the tablet to register this vital data into the Ibis system. And as soon as I hit accept, Ibis is going to detect that, hey, Mike, this is quite unusual for you. Would you please just confirm that this is the vital that is displaying on your oximeter? Now, I won't call out any of our specific members, but it is frequent that we might switch up a number or two and we enter 89 when we meant 98, or we switch the pulse and the oxygen, and all those things are exactly why we display this message to make sure and confirm that the data is correct. So I look at my finger, my device, say, yep, I promise Ibis. That's exactly the vital that I have at this moment in time. And instantaneously, you can see a little icon pop up on the top right. And I'm going to move my Zoom box here a little bit, see if we can make sure that it's visible to you.
Yeah, I can see
as
it.
soon as that happened on your device, you got it? Perfect.
Yes.
An immediate course of action happened with the Ibis care team, in which a nurse received that notification that said, hey, whoa, 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 Mike has entered a lower oxygen than normal. Let's go ahead and give him a call and check in, ask him some questions, just like you would have done if you took that low oxygen and you tried to call the doctor's office, speak with a nurse, ask you to walk through a few steps, maybe use an inhaler or a nebulizer, which is a really strong lung treatment. And we walk you through exactly what the best course of action is to remedy this lower oxygen value. We check in with you very frequently to make sure that it's working and that our recommended solution is making a positive effect. And if not, well then, unfortunately, but at least we know that this might be a little bit more serious of a situation than what we can handle at home. And ultimately, when we get concerned because of, our heart starts to flutter or we get a little short of breath, it's a very anxiety inducing experience, at least for myself personally. And that can almost compound the situation and make it even worse. And we will be there for you immediately when those things start to happen. So you don't have to worry about getting in touch with anyone. We will get in touch with you. You might say, hey, I just flipped the numbers, leave me alone. And that's all that we need to talk about. Or you might say, hey, I'm really worried. What should I do here to make sure that I get the care that I need and the right care by the right person at the right time. So our team is here on standby for all of these various deviations in health data that you might report through the device. That could be your pain, your mood, your shortness of breath, swelling in your legs that you wake up and you might be wondering, should I take an extra diuretic or not? All of those are just standard conversations that we have with our members on a daily basis. So I just want you to leave with the lasting message that all of this data, self-reported by yourself, is connected to licensed medical professionals who are here to help you in that immediate moment, to work with you, to resolve the issue, and to coordinate the data with the people that care for you. And that can be family, that can be doctors, specialists, like I mentioned. And that's how we make the whole ecosystem work. Keep everyone informed. Most importantly, keep yourself comfortable in the home and let all the medical professionals support you to give you the best care possible. But it all starts with knowing how you're doing. Now, lastly, Sean, I'll just cover, because it's on the screen and maybe your eyes have wandered. Of course, what good would a piece of technology be without some games? That little checkerboard icon on the bottom left. We have a rewards program for our users captured in that medal that you can see on the left bar. That reward is really a thank you to our members for putting in the hard work to take care of themselves every day. I know through personal experiences with some of my grandparents, it can be an arduous task, and our motivation fluctuates to take all of our medication, to go for that walk outside, to try to live the best day that we can. And ultimately, what you're looking at the bottom reminder plan is just your checklist for the day, right? What are the things that I need to do to take the best care of myself possible? And at Senscio and Ibis, we really believe that that ought to be a fundamental human right, just being able to take care of yourself and having the tools at your disposal, which is why we're so happy and grateful for Medicare and UniCare and Maya to pay for services like this, so that you as the individual in the home don't have any undue cost to you, and you can have the resources to be able to take the best care of yourself possible. So I want to leave on that lasting message of gratitude for the opportunity to share all of this with you. Everyone's experience is unique, it's personal. And we hope that if you were to join the Ibis Health program or experience some of your time here, you'll feel that a personal connection and that sense of comfort and independence in your home.
if I could just follow up on, the fact that Medicare and, the insurance companies more and more are not only paying for these services, but trying to find new and innovative ways to, keep us healthier. Because we know that that's the root cause of healthcare costs is utilization. Now, of course, if you get sick or you get hurt and you need to access those services, or you need to go to the hospital, you need to have a test or a procedure, of course you should do it. And we want to make sure that our members have open and complete access, to whatever healthcare you need. But at the same time, it's important that we find new ways to manage chronic illnesses and chronic disease and to keep people healthier. It improves the quality of your life, because let's face it, none of us want to, be sick or be, infirmed in any capacity. So if we can take steps in our own homes to help improve the quality of our health and the quality of our lives, that is a tremendous achievement. And at the same time, it lowers the cost of healthcare, which is also a very important step. So, you're going to see us talking more and more about Ibis and other programs that are designed to, work with you in your home to keep you healthier. And I know, here in Massachusetts, companies like UniCare and Blue Cross Blue Shield are putting a lot of time and energy and resources into this type of innovative thinking, and they should be complimented for that. And I want to compliment and thank, Brenton and, the team he works with at Senscio for the work that they have put into this now over many years to try to find a solution. And it was really, it began as a personal goal because of experiences dealing with, aging loved ones. And that's led to, the state that things are at today, where this is now, ready to be made available, to the masses. And we are very, very excited to be a partner here and to embrace this and to help our members lead a better quality of life. So, thank you, Brenton. And talk a little bit, I guess, as we wrap up now, if a member is interested in this, I know there's going to be a lot of outreach in the coming weeks and months, both from UniCare as well as from Maya. But if someone is watching this video and they think that it's something that might work well for them, how can they contact Senscio and move forward?
Yes, thank you, Sean. And I'll overlay a little bit of a banner here with our contact information. Our website, where you can go and read some testimonials from previous mass retiree participants and some features, is ibishealth.org. That's www.ibishealth.org. You can read up on the history and the origins of the founder company, Senscio Systems, and I'll be sure to spell that for you because it's a combination of two Latin words. That would be Senscio, followed by the word systems.com. You're more than welcome to reach out to me personally. I've worked with over hundreds of mass retirees at this moment in time, and I've enjoyed each and every one of those conversations. I'll include my email and our enrollment line number through which you can reach myself for a direct inquiry. And I look forward to all the conversations that might come out of this collaboration. And Sean, just thank you so much. I'll do this for you anytime, any day of the week, any moment I can. So appreciate you.
No, I appreciate it as well. And, if members do have questions about this, as Brenton just said, please contact Senscio. But if you also, have questions for us here at Mass Retirees, you can contact us in the office. You can contact Cheryl Stillman, who, by the way, is a proud Ibis user, and she has been now for, I believe, about 3 years. Cheryl's been using the system, and she has, really has nothing but good things to say about it. So she's a great endorser. But again, thank you for tuning in this week, working with us. And Brenton, thank you again for your time. And we'll talk to everybody again soon. Bye, everyone.